Let's head over to the Rideout Hospital and see the latest progress in the construction of a new center for cardiac catheterization. As I was over here at Rideout Hospital today looking around and setting up some future Medical Explorer programs, I heard a lot of hammering and drilling going on and decided to come over to the radiology department to see what was actually happening in new construction and new development here at the Rideout Memorial Hospital. And I was lucky enough to get Dr. Robert Wankmuller, radiologist, to give us a little guided tour of what's actually happening here at Rideout. Dr. Wankmuller, what's actually going on here?
Well, we're expanding the department. We're putting in a cardiac cath lab. We're putting in a new x-ray room, 2 new x-ray rooms beside that. And so we'll have a total of 4 x-ray rooms with new cardiac cath equipment to do all our cardiac work.
On a previous program of our Medical Explorer, we met Dr. Henry Louie, who's one of the physicians involved in this project. He told us about cardiac catheterization. Does it involve a lot of equipment? Is it a lot of space required?
A lot of space required because we're putting in cardiac monitors and digital equipment to do very rapid arteriograms for the heart, for coronary arteries. So we had to expand our main room another 4 feet into the street. We had to put a recovery room on here, and then we need backup x-ray rooms and a backup angiogram room.
So when people drive by the west side of Rideout Hospital, I'm not sure if is that H Street? I'm not even sure.
Yes.
They'll see that construction's going on near that sidewalk and on that road, and that's the actual cardiac cath lab.
That's right. They'll be seeing that for probably the next 6 months going on.
What's going on behind you here? I see they're doing some work on this room right now.
Right now, they're expanding this hallway. We're going to be moving our dark room, and the cardiac work is done a lot on cine also. So we'll be doing movie pictures will be developed here, as well as routine films. And they're moving into my reading room here because that area is going to become another x-ray room, and we're going to be expanding out toward the south side of the hospital.
Can we go across the hall and see what's happening over here too?
Yes.
So what do we have behind us here?
Behind us is right now our main angio room. This room will become the cardiac cath lab, and it needs to be expanded. There's a procedure going in now, an endoscopy is being performed, so to keep patient privacy, we'll stay here. But this room now has a current CGR, was the top of the line when that was put in. Now they'll be putting in a Toshiba equipment, which is also top of the line, and with it we'll be having digital monitors and of cine photography as well. And we'll have a floating table with a C-arm unit that we can do all kinds of arteriograms with.
The arteriograms where you actually put contrast media into the arteries and can visualize, look at all different parts of the brain and organs and all over the body.
Right, and that makes it very simple because you can swing your x-ray tube in any angle and look at the arteries from any angle you need without moving the patient.
And that all goes on right behind us, right in here.
It's all going to be going on right here, yes.
These facilities are open for all physicians in the community to use. I mean, they can refer their patients to the radiology department here at Rideout and use all of this. Isn't that true?
Yeah, that's correct.
So it's not restricted to one group of doctors or one group of patients in the community?
No, that's a blessing. Everybody can use the equipment here.
And the equipment's owned by Rideout, and I suppose now with the combination, maybe Rideout and Fremont hospitals in the future.
Yeah, that's correct.
Thank you again for showing us this brief tour of the new developments here in the radiology department at Rideout. Thank you, Dr. Wankmuller.
You got a chance to see all the construction in operation here.
And now I have a reason why the ceiling is all broken